Now, pharma industry bears the brunt of lockdown as the transporters refuse to lift the consignment. Lockdown and curfew in many states have broken the medicine supply chain. The pharma unit owners say that they are forced to stop manufacturing activity altogether, as some pharma units, like the suppliers and printers, are fully shut. Suspension of transport services has also piled stocks of finished medicines at various localities in Chandigarh. The transporters are not lifting consignments as the truckers are not willing to move. Non-availability of packaging material has also hit pharma businesses there.
It is very clear from the notice of the central government and the state government that pharma comes under essential commodities. So yes, we are allowed to run the factories, but the problem is of logistics. We are not getting any transport from the union, so we are unable to dispatch the materials. The thing is that when we contacted these transport agencies, they said that the drivers are not willing to go.
There are some units which are running and they are interested in running the units also, but there are some issues which are coming. Staff is afraid to come out, not only because of corona, but because of social media hype of police atrocities, police hitting people who are coming out, and 50% of the staff is women. They are also afraid to come. So even if we want to run the units, the staff is afraid to come, and we are equally concerned for our staff as well as for the people.
Let's go over to Ashutosh and Saurabh joining us on this. Ashutosh, we hear that supply of medicines could be an issue because several trucks are stranded at border areas. They're not willing to move. That's hindered the supply of medicines.
Well, that's a lesson, because when you take such measure at a pan-India level, there are some preparations why they are very essential. So when the pan-India lockdown was announced, certainly these measures were not anticipated and neither was calculated by the government moon. And clearly that's now making people to suffer. Pharma agencies, they have products ready. But then it's a chain business. Someone prepare medicine, the packaging comes from elsewhere, that also further need transportation. And at the same time, the concern that being raised by the association, that there are images coming out that police beating everyone around.
Yeah.
So that somewhere has also created panic. However, from last 2-3 days, we are hearing that how the government has been appealing agencies not to use betting against the people, don't beat anyone. So clearly the people, those who are out on the road, they're not, by choice or touring around. Of course, certainly they have some reason to come around. So that's somewhere raising the question. However, the state agencies, government machineries are working to ensure, because if there is a supply shortage of pharmaceuticals or the medicines, that will create more and more panic. So clearly what we are hearing from the sources in the government, that all the state agencies, government agencies, union ministries are working together to ensure there should not be a supply. If there are some manpower, there are e-passes in different states being issued, different passes for the manpower also being issued, because during the lockdown, to ensure supply of the medicines, some units need to be functional. At the same time, the transportation is going to play a very important role, and perhaps why the government is working on that.
Well, let's see if Mumbai is also facing a shortage of medicine supply. Saurabh, do tell us, in Mumbai, due to packaging and lack of transport, is there a shortage of medicines?
Yeah, before the national lockdown was issued, before that Maharashtra was completely locked down, and that particular time there were some issues being faced by the chemist in local areas, because many of the pharma products actually come out of the Maharashtra, inside Maharashtra. So there were initially a lot of problems, but yes, the Maharashtra state government is looking into this particular matter, and therefore special passes have been issued to all these pharma companies and the transport companies who have been given the order to provide, who have been given order to bring those pharma products inside Maharashtra. Now, there is no actual shortage of pharma products as of now, but the actual shortage is about the sanitizers, mask and the hand gloves, which people are not getting, and also several other items which are like basic hand wash and some more sanitizers product which people are using in more quantities, so that people are not getting at various chemist shops, and this is the major scarcity which people are facing, and therefore the government is looking into this matter. They are continuously
let's hope
keep
that
on doing meetings on this, so there can be available all this project.
Right. Let's really hope that the clog there is eased out soon enough. Supply and packaging their issue for customers to access medication. We hope the government is listening. Thank you very much for joining us, reporters. We're going to come back to you. Now, the total number of active cases of coronavirus in India has surged to 895, while the death toll has jumped to 24 after 2 deaths were reported on Saturday. After Kerala, Telangana has reported the first COVID-19 death. A 74-year-old with travel history to Delhi was detected positive after he passed away at a private hospital in Hyderabad. Kerala remains the worst hit state in the country with 165 active cases, while Maharashtra has 152 active cases. Meanwhile, as cases continue to mount, Home Minister Amit Shah held a review meeting on Saturday to discuss the measures to control the spread of the deadly virus. Now, even as the nation battles coronavirus, the centre and the states have stepped up their fight against the deadly disease. Here's our exclusive report on how Prime Minister and his core team of ministers, bureaucrats, are handling the situation currently. Take a listen.
India's 1.3 billion people are indoors to defeat coronavirus. And the challenge for Modi government is mammoth. State chief ministers are the federal arms of the governance. The centre is the command and the control centre is headed by the Prime Minister. Backing the PM are core teams. In the nerve centre is the PMO, manned by 2 key PM aides, Principal Secretary PK Mishra and Principal Advisor PK Sinha. Cabinet Secretary Rajiv Gauba is another key member of the core network of the government. Then there is a group of ministers to handle all medical and technical issues. It consists of Health Minister Dr. Harshvardhan, Civil Aviation Minister Hardeep Singh Puri, External Affairs Minister S. Jaishankar and MOS Mansukh Mandavia. So far, hundreds of health, aviation and other advisories have come from this group of ministers. Health, Home, External Affairs, Defence, Finance and some other secretaries form the first layer around the core officers. Home Minister Amit Shah and his ministry is handling interstate and order issues. The External Affairs Ministry is coordinating with countries all over the world on transit issues of Indians abroad and foreign nationals in India. Finance Minister Nirmala Sitharaman has been entrusted with the task of balancing welfare measures and health of the economy. The Prime Minister is depending on multiple layers of information sources to keep tabs on how things are unfolding on the ground in terms of outbreak, prevention and correction. The idea is to cut down communication time and slip-ups. The Prime Minister has allocated specific states and districts to members of his council. They keep tabs on availability and shortage of essential commodities. The mechanism has been paying dividends. Information technology has become the backbone of operations. Official ministerial meetings are being held via video conferencing. With Rahul Srivastav in Delhi, Bureau Report, India Today.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.